We're going to start with a restorative infusion of sorts to emphasize the length in the front. We're going to focus on strengthening our hips in that integration today, but it'll all feel like a restorative balance. So have a wall space right next to you, have a bolster horizontal and a couple blankets behind that. And I want you to lean back into the bolster, but have a block right next to it. And it should be smack dab touching the bolster, even when you're reclining. So if it seems to be slip sliding away, just make sure it's in contact. And the block should definitely be flat. The belt that you've got nearby is in a big loop. You buckle it up and just put it off to the side. If you have a ball, that's going to be really good for our hip strength work. If you don't, you'll use a block instead. And have a sandbag. Okay. I like to kind of play with how I get into this. Sometimes I go right into sitting bone on block and then push back with my spine arching. But sometimes I'll just kind of play with, okay, and maybe I can tip the sacrum onto the block. So keep in mind you want to use both block and bolster to create some access into the ribs, okay? Even though you don't have ribs down in here, into the hip bone here, the pelvic bone. I want you to get a feeling that there is some strength here just to recline. And then once you're on the back, and you might even feel the pelvis kind of having a little bit of a tug of pelvis on the block. Okay, but the block is really helpful here. And then add your sand across the upper thighs or across the ribs. You get to decide. In fact, since this is kind of a different integration today of sorts, right? I'm always being a student here. You might decide to extend the legs. If you happen to be fortunate to have the wall touching the feet, you can work with pushing into the balls of the feet, maybe micro bend the knees. And then as you add the sand, I prefer the tops of the legs and to kind of refresh this spine, the anterior tilt here of the spine. So you're going to feel like it's kind of shooting out of the pelvis. It is. It's kind of, it's not quite like fireworks out of the back of the pelvis, but it's not that far and beyond that idea. The feet could be turning in. If you've got a wall, it's kind of nice. You can keep that position of the legs so they're not rotating out. If you don't like this version, have the knees bending and the sand either on the thighs or on the ribs. Okay, and then let's come into the shape of creating some heat into the hips and stretch open the chest. 1 or 2 blankets under your head, you decide. I think at first the comfort of having a stack is nice, but I imagine that if you're kind of just scanning the sensation in the muscles, especially along your back, most of us want the area in the back to try to have a little bit less rounding. And that includes all the way up into clearly my shoulders, my neck, my brain. So if you feel like you have a rounding brain, you can slide one of the blankets back. Yeah. So you decide, you can always bring it back, but you can now bring that flow of movement into the endocrine glands, right into the throat. Yeah, and however you have, focus in these front areas, whether it's muscular, whether it's an energy focus in your body, kind of an energy field in the throat. Let your arms relax wide and your eyes closed. Eye pillows are nice for this one. And gather your attention on the breath in through the nose. Ribs expand. And as you exhale, feel kind of that central vine of obviously the spine is kind of a vine, but also that center channel of the navel center up through the mid pathway into the sternum, and it centers back to the heart. So let's land here for a few more moments, feeling what you can do to create this openness whether it's adjusting your shoulders, right? They might feel like they can kind of roll back and down. Really good to be a student here of yourself and feel how the openness occurs across the breathing muscles. Give it a few feelings of the ribs and that torso opportunity to movement. You don't want to have the torso feel like it's just holding. You want to feel, especially when you're pulling yourself on all these props, you kind of, in some way, creating more tone in the center body. So your work is on, create that frequency of the elasticity of the ribs. And it's all a science class for yourself, isn't it? Right? Now bring the arms across the chest. So just wrap the arms, whichever arm goes on top, it doesn't really matter here. I want you to feel that the elbows try to cross. Now, if it bothers the chest, focus on the back stretching. So you don't have to be squishing your chest, but you are reaching the arms around. I like to purposely do this without clutching my back and just feel what upper back muscle, and on either side is kind of corresponding with this movement. And then just switch the arm that's on top. Just take the elbows out, alternate. Remember, you can purposely not push your chest so that you can feel that upper back reach across. And then as you move your arms back open, keep the ribs extending. If you've got 2 blankets right now, I want you to slide back to 1 if you can. Okay, this is if you can. If you can't, go back to the 2, but I want us to give it a try. We're going to start to work into the inner thigh. The inner leg muscles, right, are hip muscles, right? They're certainly connected to our hip, adductor-wise. So if you've got sand on the upper leg, you can move it to the ribs or just put it aside, okay? Now slide the feet in so that the bottoms of the feet touch down first, and then feel how the knees shift out, and then take the soles of the feet to each other. So there is a process of circulation through the inner leg. And again, like I mentioned, right, inner leg muscles are hip muscles. So this is where we're going to start working on that hip strength. Or you could say tone, maybe. Because if we have some tone, some more strength into the hip, less likely we'll get injured. Balance is better, right? We've moved through the world through pelvis, right? So when you have your feet touching, instead of being forceful with them, just see how you can find the balance of them touching. Could be the little toe side of the foot. I don't find my big toe placement very clear for me on this one. Okay. And so as the arms spread out, give about 3 more cycles of breath here. If you want to do more, that's fine. But take the arms into goalpost position and feeling, there's a difference from the last shape with the legs in a different path moving down. You might feel the attention here in the groins, right, the leg pits. Feel the belly really lift up on the inhale. Breathe through the nose, and on the exhale, feel the belly kind of sink back in and pull up towards the heart. Just give that a try. With a lot of arch into the tailbone. Okay, we're going to take figure 4, but please keep the feet on the 1 foot on the ground. We're not going to pull the knees into the chest on this version. So bring the knees to point up. And then we'll take the right foot off the ground, the right leg, not just the foot, and cross the right ankle to the left knee. And you want to feel that you are kind of on knee territory here. So then when the right hip motions open, your emphasis is just kind of lay into the space of the bones here. So I really like this variation. Especially since it's a little understated from what we're used to with prying the ligaments. So use just gravity to help stretch the leg. Yeah, we have a relationship with gravity all the time, for better or worse. You're always connected to that force. So with that right knee and its motion out, you can tell if you try to slide the right foot higher up on the left thigh, it could change the feeling in the knee. Because that's kind of lotus position, right? It moves there. So for some of us, that works really good. We're open enough in the hip. But that's what I want you to emphasize. If you end up wanting to do that pose, right? You're trying to get the hip open, not the knee. The knees want to be knees. They don't want to be opened. It's what's above them, right? That helps get that circulation and blood flow. Okay. And just switch the side. If you're curious about this one and you want to just plot it for a few more moments, you could slide the left foot closer towards the bolster. I like to have it really moderate so I can feel the back of my pelvis comfortable. Okay. And then I just switch. So I'm not teasing out the tissues. I'm just doing basic work, right foot down, left leg lifts. I definitely feel the block under me, so it keeps me in position. And then I'm isolating in the left thigh and I'm turning the leg out, connecting my left ankle to the right knee. And then, yeah, the second side could be a little different, right? It might be different layers of the adductor that is pulling. It might be the side of the hip. You can feel on one side more than the other, right? Likely the side that you have different issues in the knee or hip, you just gotta feel differences perhaps. So work on what's similar, right? The ribs could be similar on the second side. You can influence the hip strength. Okay, feel the tailbone naturally arching in the pelvi. So it's like you're creating pressure back into the tailbone, breathing. Okay, so that inner leg, that groin, gently loosening up. But keep that integrity of the hip. So now for you, you might find one side of the knee swings out a bit. I can tell one side's a little bit more compact in the joint. So what I want to work towards is now kind of sealing it up at the top of the leg, right where that we're going to work with the femur. We're going to work with the positioning into the hip. So of course you're going to work with your femurs. Okay. Now when you take that leg back to next to the other leg, arm cross, walk the feet a little closer towards your seat and see if you can find that springy quality through the balls of the feet. So you just kind of lift up the heels. You can kind of bounce through them for a moment. Heels up, roll back down, kind of alternate just for a few seconds. And then as you make sure there's only one blanket for certain on this one, what you're going to do is grab a hold of the bolster or push the top of the bolster. I have to go to the sides. It works better for me that way. And you're going to lie back onto the upper back and push the bolster down. So it just goes basically inches downward. So it's under the pelvis when you lift up your feet and you hinge at the hip. So reset. If you're a little bit uncertain about the balance, if you're barely touching the block, that's kind of nice because I know I'm at the edge of the bolster. I want my tailbone at the edge. I want my hips to lift up, and I definitely am going to work with the leg reach. So take a belt, okay? Have it so it's in a big loop, and you're going to make it even bigger probably here. So as you bring the hips into that deeper hinge, you decide, is this blanket setup working for you, right? You want to make sure it's not under your shoulders. You want to make sure the bolster's at a good spot. I think mine needs to go a little bit downwards, okay? You should feel like there is a chunk of space from the ribs to the armpit chest, but it's being pulled and stretched. So there's still, it's not like your bolster's up at your on your upper back, okay? And if you need to take it lower, take it lower. But do know that if your back is bothering you, it's probably the bolster is too high usually, okay? So take the belt in that loop under the feet, and we're going to move from Viparita Karani here, okay, to feeling if I can motion by pelvis to press back, and then I'm going to move my feet apart. I'm going to trust my hip strength here and see if I can do this without manipulating with my hands. But I have the belt under my feet. I've got a loop, so I know that I have some range to go. And I'm trying to push out slow, like there's a little bit of resistance on the side. Kind of like you have a TheraBand or something. Okay. So once you feel that you are pushing and the belt is at its reach, you can always make it wider. You choose. But if there's not too much shakiness, I would just stick with what you got. Okay, now feeling where the lower abdominals have some tone. So if your legs are too far forward, this whole region might feel like it's kind of displaced. So sometimes it's nice to just put your hands right towards the navel center, a little below. And then when you have the legs with that lift, you push out purposely into the belt. And it should feel when you're breathing a little bit of, I guess you could say, resistance, tone. That's the idea. And then just bring your arms to cactus position. If you need to hold your belt and it's really shaky, you can, right? You can bend your knees and you can slide the belt, maybe give it a little bit more belt, give it some slack. That might work for some of us better than this. This is, kind of intermediate, right? To have nothing holding no arms holding the belt. Okay, now the legs are in that vertical shape first, and then they've pushed out. So you have a wide stance. So with this wide stance, I want you to actually start to turn the feet out. Okay, of course, they're not going to turn all the way to the side of you, but I want you to feel as if you were kind of ballet-like, that you're turning the feet out. Okay, so find where there's resistance on the side of the leg. I feel quite a bit on my inner leg. Okay, so I want you to let the arms stay resting back if you can. Use your hips, use your leg muscles, and now bring the feet back to what you think of as parallel. Okay, we're not going to turn the feet in at all. That's going to be kind of a no-no for this game here, for this part. And then turn the feet out once more. Okay, you might notice the ribs trying to move as well, but I don't think I'm that coordinated to get my ribs to turn out. Okay. You maybe get them to like activate, but not turn out. Okay. Come back into parallel and just be, right? Just let it be parallelisms. And let the feet kind of soften a bit. So instead of being kind of tense with them, flexing and pushing or turning out, just let them be neutral. See what happens when you're not relying on the feet so much with leg purpose. We rely on them to get around, but we really rely probably more so, right, with the pelvis. And you can see that when someone's crawling, that there's some energy with the spine and the pelvis, isn't there? Okay. So as you bend the knees, okay, you're going to reach up to the belt, and I want you to hold the side of the belt closest to you and pull it towards you and bring the feet to each other. But as they go straight up, see if you can flex the feet. Of course, that's going to happen when you get a belt under them. But scoot the belt to the balls of the feet or to the arch area, and I want you to grab a hold and have some definition with the back of the legs together. So when you have the legs with this lift, okay, we're going to go one at a time. We'll do it pretty quick between the two. We're not going to spend a lingering time for a moment. We're going to get there, but let the left leg go lower down, and I want you to just feel the leg straight up. Find that the foot is, I know it might turn in, might pivot out pretty quick, but get some resistance holding on to the belt pretty firm. Resistance is key here. And left foot comes up, so you can have a good kind of comparison. There's not too much time in between. Left leg up, pull, right leg down. It could be straight down, it could be bending. You don't have to have it a certain angle with the bottom leg, but the emphasis is the feel of the mechanics of the leg. Okay, now next time we'll come up with the right foot, so we got both feet up. And what I want you to do is keep a hold of the belt, so the belt's holding the feet, And when you move your legs a little bit forward, now you'll slip the left foot out, and we'll simply hold on to the belt with the left hand. So you'll take the belt together and bring the sides of it together, hold the belt with the left hand, but feel that you're kind of using the weight of the leg to kind of drop into the belt. So let it lower a little bit. Okay, find your range when it kind of goes out of the hamstring fold. So this is pretty hamstring-ish, right? When it's straight up. When it lowers down, it starts to meander a bit into the leg parts. Okay. I think some people will still feel the hamstring, I bet. The leg lowers. Okay, now cross the right leg to the left side, open the right arm out on the floor, and adjust here so when the right thigh, right, you're trying to keep the thigh muscles really kind of sparked up, right? So I have the top of the leg, kind of, I'm pulling the muscle like I'm sucking up the quadricep towards so the femur, everything's very illuminated here. But then I want you to just let the left hand hold the belt, and as you get a hold of that, turn your head to the right, turn the ribs to the right a little bit. This is the more challenging piece, is the ribs, I think. So just do what you can to keep this openness with the arm. Okay? If you can do this, it's pretty intermediate, right? I observe this, and oftentimes this is really hard to get this chest area open. So we're going to keep wandering with that. Push the right foot into the belt. Just feel that pressure of activating the hip. Kind of liking this hip strength stuff. Okay, just for this day, right? Okay, so bring the right leg back up. Okay. Okay, bend the knee, and then slide the left foot in, take the belt off the foot, and get a ball or a block. You know, if you're using the ball, and it's really squishy, it's okay, right? It's kind of nice, actually, if you have one that's got a lot of give to it. But I want you to squeeze and release. So just alternating squeezes of the ball. That's it. So squeeze. Now, you might find, well, the legs feel a little different and they're energetic because you've worked one leg a little longer and the other side has to get there. So take a moment when both legs swing straight upside down. You want to have the ball so it's between the knees, not between the upper groin. That's not going to be very helpful here. So just holding that ball. Feet are pretty passive. They're not trying to flex or do anything fancy. Okay. Now see if you can move the legs a little bit farther back towards the chest, like if you're going into a halasana or plow pose. Okay. And as you bend the knees, your feet might get tingly. It's not good to stay in the position if your feet are falling asleep. It's kind of defeating the purpose of what we're doing. So bend the knees and take the ball out and get a belt under the left foot. And as the leg goes straight up, let the right leg either stretch straight down or bend with the bottom of the foot on the ground. Perfect option. I think it's going to end up extending though at some point. And then I want you to just get a feel of that reach of the heel. Okay. Pull, and as you're pulling to bring the belt sides together, it's not like you're going to, the bottom of the foot's going to stretch apart that much. The skin on the foot is a little bit thick, right? You got thick skin there. Okay, so when you're flexing and you're pulling and make the belt come together so the right hand holds onto it, you might let the left knee have a little nano bend, so really slide. But feel how the hip placement is. Right leg extending, and then as that left leg moves over to the right side, feel the back of the pelvis centered, whatever that might mean for you. And it's okay if you're sensing like the right hip is sliding a little bit under and towards the left hip when the left hip is stretching. So you're kind of rolling a bit on the hip, aren't you? You're kind of shifting the left leg, rolling on the hip. Oh yeah, it's a lot of hip strength work, resistance. It's also a good stretch. It's kind of both. This is a good one. Now I can let the leg go a little bit downstream, which is my preference. Left arm open, chest wide, head turns to the left. Okay, and feeling where that circulation is reaching through the arm. Now, if you're gripping a lot with the bicep, it's not a bad idea to get some, some isometric work here, but just noticing if you need to slide down on the belt a little bit or lower your elbow to the ground. It's kind of one where you need to hold on to a belt. I don't have a modification with like a block or something on this. So if you can't, work with it, you can always pass and maybe have the left leg crossed over the right leg, knees to the right. That kind of thing could work. Could justify that as a modification. But for the meantime, give it a few more breaths through the nose. And feeling how the waist extends. Okay, now bending at that left knee. Okay, and bring your head back center, of course. And then find a little resistance. You just bring the leg back up as we know it. Okay, bring the hands to hold on. And I want you then to slide the right foot in, bend the left knee, keep it simple. Slide the belt off and then take in the ball, and you can put the belt away for now. Put it close by, don't toss it across the room. And arms open and now knees just side to side. You might be squeezing the ball a little bit, but I want you to get a feel of kind of some free range for the back of the pelvis. And when you're holding a ball, it's kind of hip strengthening, right? Two ways we could do hip strengthening would be we're squeezing into something like a ball or a block, or we're going to have a belt around the thighs in a little bit. That will help strengthening. Boat pose is a strengthener for the hip. So take a reach of the back muscles, like you're trying to create this kind of smiley face here. Your knees go towards one arm, then they switch to the other, keeping that stretch across the back. Okay, taking about two more, just cross band. Okay, now kind of feel when you move the knees side to side. Take a couple more moments here. How this coordinates the circulation across the back. It's really nice to do this on our back. We're going to give a try sitting up in a moment with it. Okay. It'll be good. We're going to give it a try. So if you want to pass on the variation, you can always pass. But take a feel of moving your knees to one side, and you're going to, I think you got to take your ball out. I don't know how I'm going to get to sitting with the ball between my knees. And slide down and move your block, because it sure is a bother right here, isn't it? So move the block so you're going to sit next to the bolster. I want you to be on the floor directly in front. Okay. All right. So ball between the knees. Lean back with your elbows on the bolster. Feet apart. Yeah, you might kind of have the foot direction. This is a nice one to do sometimes with your feet up on a wall. It's a lot of energy, so I'm just going to stay with my feet down for the moment. But I want you to squeeze the ball and release. And take a few times where you just alternate squeezing and kind of sense awareness of your back. If you're not lying on your back, it's not going to feel like it's flexing. It's not, it's now extending, right? You're getting more arch. So squeeze and release and squeeze. So this is simple, just an exercise of movement for strengthening, right? You can tell that's occurring, some strength, some adductor pressures are going, and pelvic floor, right in your pelvic floor. You can feel that little bit of pressure. So when you do slide the feet a little closer, you can stop the squeezing energy But see if you can flex the feet so the toes are up, lift up at the heart, and then just lower the foot back down. So when you're lifting your foot, just like you're tapping your foot kind of thing, it's kind of fun to do, but I want you to slowly flex. And when you do flex your foot or your feet, squeeze the ball and relax. So I flex and squeeze. I don't stay with it long enough and lower down. Do about 2 more because we've already done enough squeezes. And as the last one, okay. Lift up at the chest, get a hold of the knees, so just below the kneecaps, right? And you should feel like that's a pretty bony surface that you're holding. It's not soft tissue, it's bone. So when you're sitting up, I like to use the bolster a lot. I like the cushion of it, but I'm going to work for a moment on lifting the heart and moving the ribs forward, breathing. So inhale, and then as you lean back, don't worry about pushing I don't want you to worry about squeezing the ball right now. So pull yourself up to center. Okay, now as you come back up this next time, I want you to visualize the legs going up towards the ceiling. Just visualize it. Okay, and then lower back down to the bolster. Okay, and then coming back up center. Okay, now as we take the ball out, good. Take a belt. I think it's in a buckled loop for some of us. Buckle it up so you got a loop. Bring it over your head. And now we're going to scoop up our feet so the knees get close. Okay? They're close. They're as close as they're going to get. But I want you to scoop up your feet here. So I've got my belt around my upper back, and I'm going to bring my belt under the feet, and it should feel like you're holding the upper bones. You're connecting them to the lower to strengthen your hips, right? And of course, we think of it as the psoas too that we're working on. But I want you, I know the feet, we used to put like little pieces of yoga mat between our feet. I think they did that for a while in the studio at the very beginning time, but that was kind of a silly prop to have. It's just about comfort. Okay, but lean back so much. You get so much more comfort of this if you lean back. You can almost never go back enough. And if you're right next to the bolster, you might just use that as a support. This is also a very, very good strengthener for a hip if we lower down. So I want you to have your belt firm so you can keep it supported. If this for any reason hurts your chest, like you're feeling like, oh, this is just not a good thing on my chest, you can always slide the arms on the inside of the belt and have it around the upper arms. Some people like this better. It gets the feet higher. You can tell it just pops them up a little bit. You might go, I like this one better. You know, to you. I don't know if there's going to be a benefit that you're squishing your armpit. Okay. Now, lower the legs a little bit down. You can touch the floor. You can reach forward. You get to choose. Maybe challenge yourself and reach forward. If you fall out of the position, you're not far from the ground, so it's not that big of a deal. But if you do start to lose your balance, I want you to bend the knees a little bit and see if you can lower the feet a little bit down. Just bend the knees or straighten the legs. Chest is trying to stay just neutral. It can't really stretch open that much here. Okay? Now I want you to hold the backs of the legs, so however far up the legs are, or bending, and lift up at the chest. Ribs expand with the breath. Make sure the buckle's not under your feet or your ribs because we don't want it to quickly snap. Okay. Now, as I bend the knees, you can tell how much the upper back helps with the balance. And keep bending, And now hold the belt, and I want you to give a good tug on the legs. You're pulling the arms to pull the legs into that bending position. And then as you start to lower down the feet, take care for the knees. If it's too much resistance on the knee band, like you feel a lot of pressure in the ligament on the side or inside, you can always unbuckle, okay? But you are going to lower down, and if it's good, you're doing some good work across the knees. And I want you to lean back, breathe. If you've come out of the pose, it's okay. and then lower down, heels down. Okay, take the belt so it's not around your back. One more. You can keep it buckled, probably not a big deal. But I'm just gonna scoop up my feet with my belt. If I can finagle this one. So I'm just gonna make it kind of a double support with my belt, double it up, and then pull on the bottoms of the feet. I promise you your feet are gonna get a break in a moment. So you're gonna hold, and your sitting bone sensation is pretty dominant here. And I want you to have the knees separate, separate, separate. Pull the feet closer towards your groins, and then just see if you can pop the feet up off the ground for a moment. Your knees could be apart. It's not a problem. I'd rather have you activate the hips, strengthening, than try to push the knees together. So take a few moments here. Pull with the hands on the belt. Lift up with the chest. Breathe. Okay. I felt that this was helpful for my hips this week. I was surprised, but pull and then lower down the heels. Okay. Now windshield wiper. So just sitting back a little bit into the bolster, elbows on the bolster. If it's not close enough, just pull it in. Feet as wide as your mat, and then knees side to side to massage a little bit into the glutes. If you feel like this is not going to get any massage work going, just trust the body weight pushing into the floor and the knees swishing side to side. Okay, the feet could be farther down than mine are. You might decide you want a little different slide into the kind of shearing into the glute. Okay, but purposely feel weight of bones, and let's shift to the left and let's take side sage. Hooray. Okay, so pull the bolster next to your left thigh. You can explore this with, if you have another bolster that's round, you can put that under your waist on this one too. I like that. You could do a round bolster, and you could do blankets or a bolster instead of the blankets if you happen to have a bunch of props. But take a bag of weight, okay? Have a block overhead, high setting, and then grab your ball. Okay. If you don't use the ball under the knee and you want to try different things, I've also been doing some myofascial technique work right with the ball. So I've just been playing with all kinds of things with this work. So you could stay with this for a few moments, kind of massaging into the ribs. You might think I just want to do yoga, but play with it. This is practice. So the ball generally is on the inside of the left knee or thigh. Some of us might put it under our ribs. Believe it or not, it kind of works, but it's a tricky breath situation. And then get your sand on hip across. I think this would be a good one today to have it hip focus. Okay, especially since the last shape is that we were doing, the shapes were influencing this area. Okay, I wouldn't say it's hurting, it's toning. Okay, so pull the blankets in. Be sure that you have a good stack. If you're using the bolster instead of blankets, okay, it's just as well. So right arm is either over. Now we've had the arm pretty tight the last 5 minutes or so. The arm's been kind of by the side and pulling. Probably for 10 minutes you've been tugging with the arm in some way. So it might feel kind of short. Your ribs might feel tight. So we're trying to elongate. But give it time. If you can't reach your block like you're used to, it's because of what you're just doing. So it's okay. Take the time. If you don't want your arm overhead, no problem. Right hand could touch the bolster. Right arm could stay on your side, or just kind of let it roll back onto the shoulder, spanning the chest. You never know, maybe you're near a wall you can touch, huh? You can definitely play with this one. I suppose you could even use that block that you have overhead. If you don't like to put your arm overhead, it just hurts you. You could use it now next to your bolster by your right hip. You can kind of position it so it's at its high setting and put your elbow on that. It's kind of interesting. I like that quite a bit. Because again, I want to support this length on my side. I'm not concerned about how I look, but how I feel in the circulation. Yeah, so you decide on what works for you. Overhead, hand on something, elbow down on the block. Even if you feel like you're falling out of the pose, yeah, you're kind of falling into the sensation likely. Maybe close your eyes, maybe adjust your whatever's under your head. Arm on the left side should be really passive and let it go. Okay, now track what maybe tightening up. It could be like the tailbone could be tightening. It might be the front of the abdominal area might feel a little rigid. So use the ability to breathe slow and deep. You know, sometimes we move through these shapes a little fast, I'd have to say, maybe. So you can always just stay a little longer until you feel like, okay, I'm receiving the practice slowly. Okay, now let's start to shift. The right arm goes off of the block, and we're going to use that right arm maybe to move the sand, right? That might be intelligent. You can also let it just kind of drop off the back, okay? Now, taking the focus here in the front of both, the femur on both sides. So we're going to try to get it to kind of lay down the bones, the front of the bone, just let it lay into itself. So when you turn towards and twist a bit to the left, you can tell that when you come up here, we're going to bring the bolster under our hip flexors, right? So, and that could be a long topic, but let's have it so that the thighs lay into the bolster, right? My front legs, I find a little close to the wall and I have to push forward. But I want you to have the hands so that they're pushing the floor away. Okay. Take a few moments there. I want us to work our way into our back muscles safely. So it's kind of a wraparound effect here. Okay. Pushing into the wall is really nice for this. If it hurts your knees, you can let the knees lift up a little bit. Okay. Now I'm going to keep my knees out because part of this whole experience for me is continuously studying ways I can help myself by myself, right? So how can I help out the circulation here? So when I lower down, I'm using my posterior core to lower down strong. And then I'm going to use my blankets under my arms. I'm going to bring the elbows out, just my kind of my forearms here, or my two arms. Elbows are wide. See if you can do a little bit of tummy time here. If you're like your belly doesn't like this pressure, you can always practice with maybe, you don't have to have your belly on the bolster. You can do this with one blanket and the core on the floor. That's okay. So the elbows are wide, but when I push back a little bit with my legs, even if the tops of the feet are on the floor, I'm going to curl the toes under and work that posterior core. If you touch your back, I bet you it's the erector spinae. This whole area is really toned. Like, whoo, there's a lot of postural strength here for this one. So keep that tone. And then I want you just to let the knees relax down, unless it hurts the knees, let the knees come down. So you're not putting energy into pulling in the lower back as much. Because if I lift my knees, I tighten my back tightens a little bit. Okay. So now I want you to lower down entirely. So you might turn the blankets. I like to have it this way. And then my forehead down on the blankets. Okay, let the feet turn in so you're in more passive position with the legs. Breathe. Okay, relax the buttocks. So let the bones have their experience in the muscles of contracting and releasing. You might feel the pulse, right? You're going to feel a bit of a pulse in the belly. Right, the arms are pressing a little bit through the elbows. They're moved out. Almost a sphinx pose, but my forehead is down. Okay, now use your arms to push to bring you up. So try to feel where your elbows are. If you need to kind of quickly scurry them in closer, that's okay. But I want you to feel the elbows push. And then the crown of your head extends out from your position, right? So away, so the neck is long, and then just lift up. Okay, slide the hands back, and then the hands are just across from each other. Lift, pushing. Funny enough, right, when you're in your daily habits, they're probably not across from each other very often, so good to do the practice of it, huh? Okay, so now we're going to take the blankets back to that horizontal position, come back to hands and knees, and then round the back into cat, and arch the spine into cow. Just flex and arch. That's all. Just rounding the back and creating that kind of fancy arch from the chest muscles back through the pelvis. So just notice, take the final moments here with the recognition of this kind of curious movement. You can tell where the muscles are loading, right? In my hands, I can feel the load. In my knees, I feel a little bit, but it's that mystery movement of the spine and the pelvic floor, right? It's kind of curious. Okay, take a downward dog if it's okay. If that feels too strenuous, you can always pass, but lift up the knees. You can take child's pose if you don't want to do an inverted position. Let the knees lift for some of us, the heel stretch towards the wall or to the floor. Wherever you happen to be is going to work great. And emphasize that reach through the calves. Breathing. Okay, now, you're going to feel the balls of the feet, the stretch into the legs, the lift of the tailbone. Give it a few more breaths. Okay, now walk the feet towards the bolster or the hands back towards the bolster. I usually go both. I bring hands back to bolster, feet towards bolster. And let's take a forward fold. Now you get to choose. Do you want to be away from the wall or near the wall? I honestly like to use a wall for my forward bend quite a bit. So if I can move my seat back towards the wall, have my feet positioned far enough away so I can lean into the wall with my sitting bones, and then I can create that arch of the spine and then lower down my brain so it's hopefully can get below my heart. So the circulation in the skin cells of the face is going to get pretty busy fast. So once that change of your experience with the world, right, brain upside down, let your head lower and let the hands either hold the elbows or the legs, or maybe you feel more confident touching the wall. Okay. If you find the blood pressure switch is too much for you, brain-wise, probably touching something firm is going to feel really good. That's going to be good. Maybe the bolster, push it in, maybe clutching the legs. If you're pretty carefree about it, you can hold the elbows, change the crossing of the arms if you were holding your elbows, and then feeling that thorough circulation back towards the brain. Take a few more breaths here. Let the head maybe nod side to side. And just let the weight of your brain help stretch your back. How else are you going to get traction in your back? But to dangle the brain down and let the spine stretch. Yeah, you might feel really pretty lucky here, getting your hamstrings to stretch. The bones at the tops of the thighs, right? The femur bone feels very toned. It's kind of nice to get that energy through the bones. But now when you come away from the position, the hands are going to have to release at some point. And it depends on your flexibility a little bit here. But having strength is really, is quite helpful too. And I don't want to be just Gumby trying to get out of this one. So you're going to walk on forward to the bolster and then the floor. Careful. Easy does it. Okay. Feet walk back. Knees lower down. Take the transition slow. Make sure you're grounded in the hands and the knees and the feet. Arch the spine. Just gently lift your head. You can feel that circulation in the face. And then come to neutral. Okay. All right. We're going to go to side stage with the right hip down. So you're going to switch to the left leg reaches back. The right knee crosses over to the bolster. Just like you would do pigeon, it's kind of a similar positioning for the pelvis to move, but it sure feels different than pigeon for me. So block overhead, ball on the inside or on the rib side. And if you're kind of curious about this, you can always just try it. Sorry, Ace. You can always try. I kind of like it. Especially if you want to feel like, try to make yourself a little more hardy, right? Probably going to help a little bit. I mean, the ribs are maybe a little sensitive to the ball, but I like to play with that circulation. So I'm missing my ball in my knee. That's where I like. So take the ball, remember you can use your opposite foot to maneuver the ball on your knee, not on your ribs. And once you lay into the circulation, if you're futzing around with the ball or anything, go for it. Futz around. But have the reach of the armpit chest just as important as the reach of the leg bones with the bending right leg. Some of you might take more of a scissor kick approach and let the right leg almost kind of straighten. So you keep the load into the hip. This is good medicine here. We want to let the weight be sinking. So you don't want to try to resist and kind of do abdominal crunches or something, right? You're just letting the sand settle on you. However your left arm is, it might be down on the bolster. It might be overhead. It might be, like I showed last time, some of us were, playing with it. Maybe we didn't come around with keeping this position, but maybe your block is under your left arm. Yep, it's kind of nice to do, but I'm trying to keep the sand on my hip for this today. Part of it's all the hip flexor work we've already done. I want you to feel like you have a good balance of toning and releasing. Make some good functional strength work here. So let the weight sink, whether you're a little bit arched in the spine is fine. And your head could be resting on the back of the skull. You might be, if your arm is overhead, you're going to be on the side. Yeah, don't forget, if you did use a round bolster on this one, you got to use it again on the second side, or it'd be very strange, huh? Okay, so finding the weight on the exhale. A few more moments here. where the upper arm is, you're going to bring it back to help you come out of this combination of kind of the fibers, right? The stretching. So I let the left arm come back around. You can let your sand slide off anywhere. It could go inside or outside the hip. But when you do turn, now we're going to manifest our awareness from abdominal muscles to posterior core, which of course is spinal as well. But just kind of feel the gravity of your positioning. So you're going to turn right. It's nice to lie into the props, but when you rotate this time, we're going to come around to sit on our bolster. Okay? So take the seat on up. Okay? And take the right leg straight. And we're going to use our sand in a few. Let's see how I'm going to position this. So bolster horizontal, doesn't change much. Right leg straight, cross the left leg over the right leg. You know, the wall could be really nice for this one, huh? Yeah, get closer to the wall. This is important. Okay, so place your foot at the heel, like the baseboard, depending on how your whole wall situation is. But if you've got a sandbag, I want you to put it over on the right side of your mat. Okay, then again, left leg crosses over, right leg straight. Lift up. The knee points a little bit out. Okay, if you don't want to use a wall, you don't have to. It's definitely nice to have though. And then I'm going to turn to the left. Try to keep it not so high and mighty, but feel how ribs kind of rotate downwards and twist, right? It's almost as if there's some help that you have a hip base. So connect the right arm to the side of that left leg. Bring the left hand back, maybe to your blanket. No sand on this one. And then you're working with, again, a little bit of leaning down. I don't want you to round the back, period, but I want you to feel like you're creating a natural, nice combination up the spine, like it's a trail. You can kind of envision being looking at a map, like it's a trail moving through the spine. Okay, so feel when you rotate, where is the rotation in your spine? I want it to be a little bit, it's in the middle, it's the middle path, isn't it? Twists are kind of middle path work. So as you motion back forward, we're just gonna let this right leg hook under. So I want you to bend the right leg, foot towards the bolster, and then take your sand up on the inside of the right thigh. Yeah, this could be kind of really interesting for adductors, right? I know I'm a little excited about something on my own, huh? But we have the foot pushing, and now we get some energy current through the leg. Now we have sand on the inside of the right thigh. Cross the left leg over. I'm sliding off my bolster here. Turn to the right hand back on the blanket. If this is too much on the knee, guess what? You can straighten the leg again. Okay, you can touch the wall with the foot again. So you decide. I mean the bottom leg, if that's bothering you. So if the knee is a little challenged, see if you can situate yourself. So you roll a little bit forward. So you're dominating that lift up into the central axis of the spine. Right, you're trying to hydrate, right? The disc hydration comes when you come out of the twist, but feel that rotation. Okay, come back center, just huddle up with the knee, left knee, lift up the chest, breathe, and then exhale, turn to the left. Bring the left hand back, the right elbow to the left leg, and then feel that rotation. Probably similar to the last time you turned, but you're adding a little bit of hip tone here. You're pushing into the knee that's turned out. The hip is turning out, right? Okay, now come back center. Okay, and let's take a cobbler's pose. So we're going to bring the soles of the feet together, or you can also put a block between them if you like that variation. I like soles of the feet and sand on the feet, but there really are a lot of variations that are all good. So take a lift of the chest, and we're going to stretch out through the inner leg. Lean forward. If you're close to a wall, I would just get a hold of the wall here. Reach to the wall and keep the ribs stretching. Like if you were doing cat-cow with the spine, arching and flexing, take the hands as close as they can get. If you don't want to reach to the wall or it's just too far of a stretch for your legs and your back, bring your hands above the inner knee, not on the kneecaps at all, and just tilt forward. If that's too much, it could be. You have your hands on the bolster, around the back line of the bolster, and sit upright. Breathe. Okay, now come out of the shape, come on up, take the sand off, and bring the left leg forward, so push into the wall. The bones aren't going to be straight, but sometimes I'll look down and go, it's kind of curving. So I want you to feel that you're pushing, and then you cross the right leg over, the left leg, the right foot crosses over, and then when you turn, right, you want to feel like, oh, these muscles aren't like, it's not like typewriter movement, right, with the ribs. You're actually spiraling around to position the right hand behind you, left arm to the outside of that right leg. I also really like this version when you clutch onto the leg, so the right leg with the left hand, lift up the chest, and then turn. I think I prefer that for this because it kind of lifts up into my sternum, right? The diaphragm movement is interesting on the turn. Connecting the elbow works okay, but they're both kind of good. So you decide. Left foot, toes are up, foot is flexing straight up, not turning in. Breathing. It only helps. Okay. Take a few moments before we come out. Notice if that left foot is trying to pivot in. Okay, you want to feel all the way up into the sitting bones, that support. Okay? And then up into the spine. Now you've got a whole, a whole spine world. We'll call it spine world, WHIRLED, spine world. Okay. Now feel if you have the muscular kind of engagement here to come forward, take the left leg, cross it under. You might go, oh, I'm pretty tricky with this. You might be able to find some leg tone that helps you do that. What I love about that variation is my right leg's crossed over left, and it stabilizes my knee so much. I can keep the inner leg stretching. So take the sand on the inside of that left thigh. It's kind of up on the top of it, isn't it? It's not just inside. So if your hip flexor is starting to feel like it's getting sore, right? Try to work on the lift of the ribs, the right arm on the inside of the right leg. Turn to the left so you're rotating, and keep that inner focus with breath. I mean, we know inner lift, but maybe you emphasize on the inhale, lifting up, and on the exhale, that movement of the chest back. And it's a strategy in resistance pretty much the whole time for some of these shapes. So the resistance was what helps our tone, helps us keep vital, blood flow, right? That's going to cause, well, resistance is going to cause that, huh? So now turn to the other side. Now take your time. Maybe you keep the chest lifting and you just see what happens with your limbs, right? Your lower limbs are steady. Your left hand to that right leg, you're going to turn. So feel how the waist rotates. Feel how the weight is into your hip, right? Maybe more left hip than right hip. But what I like here is to feel that I'm pulling. And I do know that most of us are going to want to connect our left arm kind of straight across the right thigh. But consider if you can do that, if you can push the arm in to the right thigh, you want to consider, stay in the pose, that you're stretching this right side of the torso, right? You're stretching into well, there's all these abdominal muscle packs of them, right? You got many. but it's kind of obliquish, and then you're crossing back. So you want to feel the abdominals get the stretch too. I don't want you to just feel it's firing off into the, right now come back through to center. Okay, and let's come out. So I want you to uncross through the legs, take the sand to the side, and we're going to come out with pushing our feet to the bolster. So I want you to carefully reach back to your blankets, slide down off your bolster, and then push the bolster to the wall. So take a little field trip, scoot it to the wall, and you're going to get a belt. Okay, so belt. We're doing hips this whole time here. Okay, I'm glad I can keep the focus. Okay, so I hope you can too. All right. Luckily, it's nice outside. You take a good walk, huh? Just bundle up. So have your belt around the thighs. First things first, I would lower on your back. Okay, if you've got too many blankets under you, you're going to take one away anyhow. So have your favorite blanket, or whichever's there, under your head. Okay. All right, so I want you to bring your knees to your chest and take the belt, so tighten it up so that it's around the legs, and you want to have it so it's, and when I look at my legs, this is below my knees, but I know if you're standing, it'd be above. So I want to make it so it's pretty tight, and when I lower down on the bolster, I have to push out into the belt. Okay. So I want to have so much energy pushing out the belt that I feel in the moment less pressure in my feet. And then I'm going to use them. Okay, so I want you to loosen it enough that it's not so much, you don't want to cut off all your circulation. Okay, so take a ball, if you got one, push into your feet, lift up your hips. Luckily, it's push into your feet, and there's 2 feet. Okay, ball goes at the sacrum, so the final bone of the spine. Sounds like a serious situation. Okay, it's the final bone. Okay, now lower down onto the ball so that you're going to do a little bit of kind of shearing work on the sacrum. So you're going to lower your weight onto the ball. Okay, feel the natural tailbone tipping back on the inhale like a cat-cow. But what I want you to do is actually kind of rub out the sacrum. So you're going side to side. Don't spend energy on just cat-cow, but pushing into the ball. So you're going across the back layer of the hip. This belt thing is going to be kind of interesting. So make sure it's holding your legs in this position. There's resistance. And now move the ball just to the right buttock, and then you're going to roll into that right glute area. So your hands can rest on your ribs. They can rest on the ground. You can bring it back overhead, out to the side. That's probably my favorite. I can feel my hip move comfortably. Okay, so give it a few more kind of glides into the glute gliding. Okay, come back up, move the ball to the other buttock, and then massaging into that area. Let the body weight drop into the ball. The goal is not to get the hips higher right now, but just to lean into the ball, kind of soothing into the muscles there. Okay. Now again, arms could be any direction. They could be out, back. Okay, they could be ribs. You choose. It is a focus on the glute, so the arms aren't as big of a deal here. Okay. Now we're going to push down to the feet, come back center, and have the ball at the sacrum again. Okay, but I want you to lift up your hips so that you're coming into a bridge pose. I don't like a blanket under my head for this one. Okay, because I want to feel the natural, and keep the bridge pose. I want to feel the natural arch in my cervical spine. Okay, it spends a lot of time rounding in our culture with phones. So I even like to kind of put my finger pads at the backside of the skull, and then just let that create that natural arch, arms down by the sides, palms open. Okay, lower back down to the ball. If the ball kind of moved a little bit, just situate it back to your sacrum. So it feels like, I lay on the ball, It gives a little bit of this kind of responsiveness, right, in the tissues, a rebound. Breathe. Okay, push into your feet, lift the hips up, strengthen. Okay, I'm going to keep the ball at my sacrum. I personally like that position. Some will take the ball a little higher on the spine. I'm kind of basic. I like basic work sometimes, just simple, elementary, and just lower back down. Okay. If you do move the ball up the spine a little bit, you might really like that stretch into your front ribs, because what's behind you is kind of pushing up, and then the tailbone can touch down. That's kind of nice. What's even better is if you have two of these balls, you can kind of swaddle the ribs and lay in it, and it's like this nice embrace, and it's really cool. So that's something to play with if you got two. Okay, now when you lift up the last time, you're going to push, and you want to push out into the belt so much. Okay, if the ball is not felt, you might push a little higher right now, just so you know you've got a helper. Okay, arms are by the sides. This is key. I know we've done this back and forth before, but we're strengthening up here. You can feel the dent, right? You can feel the femur, the bones, strength, tone. You got to get that. You got to get some of that density here. Okay, now take the ball out, lower the spine down, and as the knees scoop into your chest, happy knees, unbuckle. You've landed. Okay, hug the back of the legs for a moment, rock side to side. And we're going to set up for a hip crossover position. We'll do a final few poses. So I want you to take your blanket in under your head, and you're going to push the bolster over to the right side of your mat. If you like to do this with the bolster under your feet and hook the leg over like so and swing the knees over, that's fine. Okay, there's a few that like that. So bolster to the right for my variation. My right knee's going to bend. I'm going to swing the left leg over to the bolster, and then add my sand across the thigh band, the side, so the IT band, and then the ball to the sacrum. Open the left arm. Yeah, we're going to do these, not a long set for this hip stretch, because I want you to end up feeling like you did more strength, okay, today. So that's what our emphasis is. So when your ribs have some movement here, maybe complete that movement of the in and out breath. Really focus on the cycle of in and out breath. Really important. Now, as you come out, you might decide to move the ball, and then you can keep the sand to the very end before you switch. So place the sand maybe into the lower belly zone or in the knee center. So that kind of reinforces the back support when I lay on my back with my knees pointing up, and the bottoms of the feet just gently rest on the ground. And then when I change sides, I'm just simply going to bring the right leg up and switch it over to the bolster on the left. Right? You certainly have to give yourself a little bit of free play with the hip in the rotation. And some of you might be really craving a deeper crossover from all the hip strength. You might decide, no, I want to hook my leg across, do more pretzel-y pattern. The sand should do the work for the hip release. Maybe closer to the center of the thigh versus right on top of the hip. Ball, perhaps. I love the ball. I feel like it kind of nudges my, right between the glutes, it kind of nudges the tail across. I don't know. That's what I'm thinking it's doing, but who knows what it's really up to. But when I feel that movement, I let my ribs turn to the opposite side so my shoulder can relax down. You really feel that rotation here in the clavicles, upper chest area. Relax the heart. We're going to the pose where we're really getting that vascular support coming up next. So feel the shoulder blade on that right side, shoulder blade rolling back and in. When you start to shift your pose, I do want to remind you, if you need to stay in this longer, do. No one has to get out fast. If it feels like, oh, it's just the pose, you're starting to receive it, of course you can remain. Okay, but right, we're kind of, the pose doesn't remain the same, right? We're going to be shifting the pathway back to the heart. So if you've got the ball at the sacrum area, just move it aside. You got a little thread of stretch into the leg. Keep up that pattern, right? So take the sand, push it to the wall. It's definitely the intermediate group today. Roll left, bolster to the wall. Okay, my cat's getting farther and farther away, pushing into the wall over there. Kind of funny. Okay, I wonder if you can push through the wall. All right, so you're going to sit up on your bolster. Get your rear really close, obnoxiously close, like you're sitting bones. And then have a blanket in the middle of the mat. I'm going to use my other blanket on my torso. And then you're going to swing the legs up. See, sometimes if I don't get close enough, I can actually bounce farther away from the wall. So you do have to get obnoxiously close. Some people are able to make their way back to the wall in creative ways. The best way I found to get my legs up, which is kind of humorous, is if you were to do a somersault. When you do a somersault to get in, you have your head on the other side of the bolster and you roll up and flip up, and it's surprising how you can swing the legs perfectly in, but it seems a little bit scary, huh? But it's fun. Okay, so sand on the feet, knees bend, and try to scoop it up. If you've added the blanket already, it's going to be extra challenging. Okay, so for digestion, right, this is a good thing, right, to get my blanket across, but sand would be better, I know, but this still gives that reinforced, and it's also kind of digesting the pose, that's what I mean. Pose digestion. Rib center, arms down, they're at the level of the heart or below for heart rest. So if I push my arms back, you can feel it in the waves of the breath. It's like emergency breath, right? If my arms go here. So I want to have them at heart level or below. Rest the eyes, eye pillows on, or socks, or whatever works to bring that curtain of darkness, or just where you're at is fine. And feeling the circulation run its pathway back to the heart. Right, the heart is the rhythm maker of the body, so it's a really interesting place to tune into. Feel the movement of the breath, the belly, the ribs. Breathing in through the nose. Exhaling, letting it go, how it feels comfortable. Now let the arms be in a position that the shoulders feel that they're able to get a little bit of weight into them to open the front body, the chest. Yeah, sometimes I feel if I push them back I'm kind of doing the opposite work that I'm attempting for that vascular support. So if I just rest them, almost feels like I move my shoulders a little towards my ears, in fact, just, the energetic of the tone of the muscle. It's just to soften here. Let's just take a few more cycles of breath. If you need to start to move your sand, that's fine. And if your feet do get so tingly, you get a lot of that tingles or they fall asleep, it's best to come down, right? So at that point, the blood pressure in the feet is 0 and you've moved all the blood to the extremities, from the extremities to the organs. So what you could do if that happens is you could take your sand away and bring your feet together, knees out, in cobbler's pose. So this is another option if that happens to you. There's some I'm usually pretty lucky that it could work for 10 minutes, but there are days, right, where it might, your body, right, is a whole little lab for some reason. It changes day to day. Okay, now once you start to shift, you're going to move your feet from the wall, bend the knees, take your sand off, and let the legs just bend so that you can hinge at the hips, hug the legs in towards the chest. If you've got that blanket, it's good. A little bit of massage into the abdominals is one really nice way to stretch into those tissues. Breathe with that resistance right in the digestive tract. That's yours to work with. And then as you roll to the side, you might want to roll your blanket out, but just roll and let the hands push to bring you around to sitting cross-legged or diamond shape, you choose, but feel where the hips are lifting a little bit out of the sitting bones. So take a little tip forward on this version at the end here. So you're kind of leaning in towards the heart. You're balancing on the hips is what I mean. So we can't make everything perfect if we're focusing on the hips, right? The upper body might lean a little bit. Bring your hands to balance in front of your heart center and just let the eyes feel that they lay inwards. It's almost as if they lay down when you close them. And let's bring the focus together as a group, even virtually. Breathing in wellness, breathe in slow. And with exhalation, bowing into that space behind your heart. In gratitude, namaste.